Thank you very much, Professor Park. I have too many things here. I have a paper, I have a computer, I have my mask. Okay, all is there. So let us start with the presentation. I'm going to turn to my colleagues at some points during the presentation because they know much more than I do about the technicalities of what we have actually achieved in Codex. So this is a little review about Codex, what is Codex, and how does it fit in the whole picture of food safety of what we heard in the keynote speech. Excellent keynote speech, by the way. I really enjoyed it a lot. So, oops, I have to press it hard, I heard, but that doesn't do anything. Harder? No? Faster? Oh, faster. Okay. Not harder, faster. Okay. That's it. So what is Codex? Codex, when I speak about it, I often say it's both a process and a result. It's like we get together in meetings with different people and we develop something together. No, that is not working. This one?
The right one?
Oh, yes, this is working. Okay, good. So we have the Codex Alimentarius Commission, which organizes the process to develop the Codex Alimentarius. So this is like a bit of terminology here. It's the commission and all its committees that work under it that develop the Codex Alimentarius or food code. And in short, we call all this just Codex. We have 189 members, which is 188 nations, plus one member organization, which is the European Union. 239 observers. This could vary because it varies every year, of United Nations organizations, international governmental organizations, and NGOs. Codex is 100% member-driven, so nothing that we do comes from myself or the secretariat, but it is all coming from our members. It worked once. Oops, okay. Codex will turn 60 in 2023, so it's just a little bit younger than I am. The history started actually in 45 and 48 when the World Health Organization and the FAO were founded. So that makes them actually very young parents, if you think about it. That Codex was started in 1963 when we had the first session of the Codex Alimentarius Commission. Now, I'm not going to go into all the highlights, but one of the highlights certainly was the creation of the World Trade Organization in 1995 and where Codex standards were made the reference in the SPS agreement. And that led to a lot of work in Codex over the next 10, 15 years to integrate risk analysis into the way Codex was operating. Then I mentioned, this is very personal, I mentioned some points, 2018, following an initiative from Codex, the United Nations General Assembly established a World Food Safety Day. And we heard just in the keynote how important food safety is, and Korea has a food safety day, had a food safety day longer than actually the world has a food safety day, which is a good reminder of how important it is to make sure that food is safe and that everybody has a role to play. And I mentioned 2022, which is the inauguration of the ACT project. Yes. So now we've seen this before in the keynote. Our first mandate is to protect consumer health. And we should do this based on science, based on scientific advice that we get from FAO and WHO. Why? Because we still have a global food safety gap. As we heard before, 420,000 deaths, mainly a lot of children. Every 10th person also gets sick of a foodborne disease every year. And we have a lot of lost productivity because of it. And all this suffering would be preventable. So Codex is working on that. And this part of Codex work has been integrated in the WTO SBS agreement. That means that if you're using Codex standards, you're fine. If you want to use something stricter, you will need to justify this on the basis of your own risk assessment. Our second mandate is to ensure fair practices in the food trade. Because with all its complexity, with all the complexity it has formed, international food trade is not going to go away, and there are immense opportunities for countries in the global food trade because it is an enormous sum. There also, this is a part covered also by the WTO, by the TBT agreement, to make sure that trade can flow fairly, and Codex standards have also been there used as a reference regarding to commodity standards. The third mandate is the promotion of all food standards work that is done by international governmental and non-governmental organizations. And because it is important that in a connected work we all work together, and Codex provides a platform there for Codex members and observers to discuss and share their experience and to agree on the common goods that we develop. The final task that we have is, of course, to publish and update the Codex Alimentarius, which is the collection of food standards, guidelines, and codes of practice that we have. All our resources are online and they're freely downloadable. We have most documents now in all official UN languages. We notice sometimes that some of our standards might be a bit difficult to apply, so we have an editorial project going on to improve the usability. And the Codex website has also become the main hub for our activities in organizing the meetings. Now, how do we work? We develop the standards, codes and practice and guidelines to provide the basis for international harmonization of food safety and quality standards. Codex texts, as I said before, they are voluntary, but they are serving as a reference to WTO, and before being enforceable, obviously need to be integrated into the national legislation of countries. This is the whole layout of the structure, all the work areas that Codex is covering. You see at the top the Codex Commission, assisted by the Executive Committee, and then the different technical committees. We have our horizontal committees, the general committees dealing with topics that affect all food items. Then in the center we have the vertical or commodity ones that deal with specific food areas. And on the right side we have the task forces that are formed to deal with specific topics, and once they've dealt with the topic, they are dissolved. And there you see the task force on antimicrobial resistance that was just dissolved last year. And one specific thing about Codex, you can see that under each of the committees you find a country name, which means that that country is the host of the committee and is financing the translation, interpretation, and without the host governments, we would not be able to work. So without the Republic of Korea, we could not have done the work on AMR that we have done. This is just a quick scorecard. I don't usually think that saying that, oh yeah, we have 232 standards, is that a good thing or a bad thing? But because it is about the quality of the standards and about what is in the standard, that's actually important. But it does show that Codex has been quite active over the years, and especially in the area, for example, of maximum residue limits, the quantity is actually important because there's so many substances coming out, so many substances that still would need to be reviewed. And there we are also aware that we need to be even better, even faster, and more complete in developing the maximum residue limits there, especially for pesticides. Our standards setting procedure has 8 steps. Goes from the original idea, a project document that comes from a member state, and then goes through a process of drafting, redrafting, commenting, discussing in the committee, and moving along through the next steps, giving the opportunity for everybody to be involved in the standard setting procedure until finally the texts are adopted by the Commission. Now, on AMR, one of the things that starts our process of setting a new standard is the Codex Strategic Plan. And here the Codex Strategic Plan says we should address current and emerging food issues. And one of the top emerging food safety issues that was identified by members, for example, in 2019 and also before, was the antimicrobial resistance, among others. So this is an important work for Codex. This slide shows the difference of work that happened over the last 3 years, because all our Codex committees before were physical. I mentioned before we had the first task force of this instance of the task force in 2017 in Jeju Island, but the last one was virtual. So what we can see on this one is actually a growth in participation, because we suddenly, one of the issues with Codex was that many developing countries could not travel to come to the meetings. Now that everything was virtual, people could come. And for me, the solution of that is that from now on, everything will be probably hybrid, because we can no longer exclude the developing countries that could participate when it was virtual. And the new form of work will be probably a bit like this conference, which is happening at the same time physically and also online. Now, let me turn to Codex standards and, oops, sorry, I need to do it on both sides, and AMR. And is AMR an issue to be worried about? Yes, we heard already this morning, it is an issue to be worried about. Nearly 5 million deaths every year are associated with AMR. And then that brings me to Codex. Is that AMR, is that a food safety issue? Well, Jeff, we know that it is an issue. We heard also a bit about the food safety relevance. Oh, do you have a microphone for him? Sorry for upsetting. So, well, say a little bit, how did you get involved in AMR and food safety, right? It is linked, right? The topics are linked. We heard a bit about it this morning. It's not a direct food safety issue, right? Is it? I will not get sick immediately. No.
Thanks for letting me chime in here, and we'll hear more about this in some of the other speakers later on in the conference. But I would say it is a direct but not immediate food safety issue. Speaking about antimicrobial resistance, obviously antimicrobial residues could cause immediate reactions and allergic reactions and toxicities and things like that. But we'll hear more about that later, and I do think it is an emerging problem. How much foodborne disease is antimicrobial resistance, and how much antimicrobial resistance is foodborne? Those are some interesting questions we'll try to tease out in the discussions later on. So,
thanks a lot. Keep the microphone there because I might be moving to the colleagues. Well, okay, just thought we had lost the presentation. So what has Codex done on AMR? Part of it I'm going to say, and then I'm going to ask the colleagues again. But Codex, in fact, started quite early on AMR. So the first code of practice to minimize and contain antimicrobial resistance was adopted in 2005. But it was not by a task force, it was by the Codex Committee on Residues for Veterinary Drugs and Foods, with a strong focus on the antimicrobial resistance, on the antimicrobial use in animal food production. Now, then after that, it was quickly clear that more needed to be done, actually, in order to find out what are the risks related to foodborne AMR. And Carolee, you were very much involved in the first task force. Can you tell us a bit more about what you did there, or are you going to tell us about it later?
I could start now. Thanks very much, Tom. So the first task force worked to develop science-based guidance to evaluate the risk of foodborne antimicrobial resistance and non-human uses of antimicrobials. And the risk analysis process is based on risk assessment, risk management, and risk communication. So the guidelines cover all three, and they also cover in-depth about risk assessment, qualitative and quantitative recommendations. But yes, I'll touch on that a little bit more in the presentation later today. Thank you.
Great. Yeah, those are quite complex texts, actually. and I look forward to hear more about it later from you. So in working on AMR, Codex is actually responding to a global priority. We have the WHO Global Action Plan, FAO resolution on AMR, asking actually also Codex to do something on this. And then finally, the Commission recommended the revision of the Code of Practice, which actually at the time was already over 10 years old. And science had marched on and the developments had gone further. And also to develop guidance on surveillance and to assist members in the application of especially risk analysis of foodborne AMR. So this is a bit the timeline of what happened. 2015, CCXEC called on members to move on work on AMR. And then we moved through the steps until finally we successfully adopted the both texts, which was is still a miracle to me. I don't know, Jeff, you were in that task force, in the second task force. Was it a miracle to you as well?
I celebrate it when it was done. Let's just say that. I just want to make a couple points here related to the timeline. First thing, as a disclaimer, I do not work for Codex. I work for FAO. So what I'm saying here is from the FAO perspective. And the Codex has been kind of ahead of the game. Now, antimicrobial resistance isn't something new. It's been around forever. Ever since there were microorganisms, they've been producing antimicrobials, and there's been microorganisms that have been resistant. And even Alexander Fleming described the issue that resistance would occur. And we've kind of known that, and we've kind of paid attention to it, but we've kind of pushed it off to the side and went on willy-nilly using whatever we wanted to do. The timeline you described here, the first code there was in 2005, I think. So this was some time ago. And it really wasn't until about 2015, and you put up there the Global Action Plan on Antimicrobial Resistance, that there was starting to be some global international concern about that. So this was after Codex had already established their initial code. So this is great. In 2016, the UN General Assembly had a unanimous resolution that AMR was a critical global health concern. And every country signed on saying that, yes, we will develop an action plan to combat antimicrobial resistance. And then this is about the same time that Codex decided to launch another task force, because this is great. If every country has to do an action plan, what are they going to do? What is their actions? So this was a critical time in the kind of the evolution and understanding. Science was being understood a little bit more. Initially, it was, yeah, that's a human health concern. Then it's like, oh, yeah, well, it's an animal health concern. And now it's like, oh, well, maybe it has something to do in plant health. And then it's like, well, the environment plays a role. And at FAO, or Joint Expert Meeting on Microbial Risk Assessment, convene a meeting to understand the role of the environment and biocides in plant production in antimicrobial resistance, to provide scientific information to the Codex task force on AMR. So it was an interesting time because science was changing and the political will was changing too, and there was a public need to have this. So I think it fits the perfect timing to have it come together. So there's just a little bit of more history in there than you flashed up and really quickly. So hopefully that's helpful.
Very much indeed. I have to admit that I'm definitely not responsible for the first text in 2005, because 2005 was the year I joined Codex, so I had nothing much to do with it. I could only witness that it was adopted. Then the risk analysis framework, yes, I witnessed a bit more, but the last one really was the one that I witnessed most myself, and that was dealing with updating of 2 texts, right? Updating 1 text and creating a new text, right? You wanted to say, Jeff, you want to say something
I was just going to say one more thing. I, too, joined in 2016, so just when this new task force, so I was able to attend the meetings. Before that, I was from an academic and research side, seeing how things were going, but so I can't take any credit for those prior activities. We'll just look at Carolee and others that were there and who helped to lead those things in Korea. Thanks.
Yes, which brings me to the second task force. Second task force. And one of the things that task force did was to create GLIS, Guidelines on Integrated Monitoring and Surveillance. And Carolee, you were one of the co-chairs of the GLIS working group that was going on, which had many sessions really to get this work on the road. Can you explain a bit more about GLIS? I mean, I'm sure you're going to talk more about it later, but just in general, where does this fit in?
Absolutely. So the GLIS guidelines give information on how, what you need to consider before you implement integrated surveillance, some guidelines on how to conduct antimicrobial resistance surveillance, and how to conduct antimicrobial use surveillance, as well as evaluation of the surveillance program over time. It's sort of where to start and where to progress with surveillance activities. And the surveillance data are so essential. They're essential for things like trend analysis, epidemiological analysis, source attribution, and very importantly for risk analysis, which brings us back to the risk analysis guidelines. Risk analysis is very data hungry, and surveillance data really feeds most of the risk assessment process. Back over to you, Tom.
Thanks a lot. So that fit very well together with the results of the first task force then, or is actually an essential element to complete it. The second part of the work was in updating the code of practice, the old code of practice, which was innovative at the time, but no longer maybe so adapted to the world of 2015 or 16. So George, you were quite involved in that work. What can you tell us more about it? What changed in the code? What were the major ideas, the major changes that you worked on?
Thank you, Tom. Yeah, the new code of practice broadened the scope of the document itself. So now it has a One Health approach. It covers the entire food chain, from the manufacturers of the antimicrobials to the final consumer. As a One Health approach, as also environment is considered there, the food environment is considered there. And the biggest section is on the responsibilities of the different stakeholders and how can we reduce the need, not only reduce the use, but reduce the need of antimicrobial. So tomorrow in the session 4, we'll go into the details of the document.
Thanks very much, George. And yes, and please keep this on. Don't remove this now while maybe Jeff will say some more about this. When I looked at it first, I thought, oh my God, this is so complicated. But actually, I think now after listening to all of you, I already understand it a little bit better, the document. But this is the framework for how everything should work together in Codex, the work on AMR, how the 3 texts should work together. Jeff, anything?
AMR is complicated. That's the take-home message here. I think we need to pay attention to that. But having a systematic approach to address the problem is very helpful, especially with a problem that it's often called a wicket problem. The people that cause the problem are also the same ones who are responsible for solving the problem. It's a societal burden that everybody has to address. There's a number of factors in here. But it all boils down to these three things, the trifecta of risk analysis, if you will. The risk communication we see on the left-hand side of the screen here, that isn't necessarily AMR specific. What we want to do is communicate to a point where we can have behavioral change. It's not just adequate to raise awareness and get people to think about it and know about it, but we need to get them to change either their practices or their management or their surveillance or something there. So that's the one part of it. Then you see the other two bars there on the left, the risk management and the risk assessment. So the risk management, that's really where the codex comes in and say, these are the options that you can do to manage these risks. And those are those other two documents, the GLIS and the Code of Practice. The risk assessment, again, I like this idea that the wording that risk assessment is data hungry. They need data because you want to base your management practices on sound science. And the other thing, you want to prioritize where your highest risks are. So if you have the data, then you could prioritize to get the biggest bang for your buck in the management practices. Okay, so that's kind of how the three of those things fit together. So it's not a buy one, get one, it's a buy one, get three. You need to do all three of them together. They're complementary. And doing that, it ends up being more than complementary, synergistic, I guess, in a sense that you can achieve much greater things if you take the three pieces together than trying to just kind of bite them off. The thing is, you don't have to take big bites of every single one of these, though. Start what the capabilities are within a given country and do the assessments that you can. Do the communication that's possible and implement the management practices that are practical and reasonable, but potentially prioritized by where they're going to make the biggest effect. So hopefully that kind of sums up this very busy slide.
Thanks a lot, Jeff. I mean, it certainly also went a little bit into the question, oh, is this whole system aspirational, right? Well, what you said is it is as aspirational as you can make it at the moment, because you can start somewhere implementing and then you can move on to the next step. And you also very nicely described how things go together. So thanks to Carolee, George and Jeff, and we hear more from you about all that in your presentations. One of the things that you also mentioned, it is a complicated issue, and it was definitely a complicated issue in Codex. We had a lot of sessions, 8 working groups, physical working groups, virtual working groups, and a lot of informal discussions until we could move from the first ideas to the final adoption of the text. So we published all that, of course, in a publication altogether for people to have ready for use, because, as you've said, the 3 texts should be working together to complement each other. They fit together so that the best impact can be made with the application of the texts. But, of course, it's not enough just to apply those texts, but they are surrounded by a number of other texts, a number of other principles, and AMR prevention starts with using good practices all along the food chain, especially also on food hygiene. And their codex has a number of hygienic codes to be followed, which can actually already contribute to less need of using, for example, antimicrobials in food production, and that can lead to an improvement in the MR situation as well. So the next steps, final part of the presentation, is about implementation. And the codex standards cannot do anything. Time over, okay. I will be, I can see that there on the side. Sorry about that. But I will just take 5 more minutes, and then we can wrap up. Now, sorry, I like to put this because that was a great moment for me to meet Ban Ki-moon when I was in Korea on one of the missions that I had. And I just wanted to use this to Codex relations with Republic of Korea have always been fruitful and productive. As long as I can think, which is since 2005 Codex related, I mean, as long as I can think Codex related, we always had a secondee from the Korean government in the Codex Secretariat, and we've had the task force, two instances of the task force dealing with AMR, and now we have something else. We have a project going on. And why do we need to have a project? Because we did some research, and data always informs, as Jeff rightly said. We could see that the codex texts on AMR are not yet as widely used as food hygiene texts, for example, or MRLs. And probably also due to the fact that they might be complex. There might be a certain level of people saying, oh no, we can never do this, right? And in fact, this is not the case. This could be done. And we recognize this, that we should do more work on this in the new Codex Strategic Plan, where we specifically included a goal on increased impact through the recognition and use of Codex standards. So the Codex Secretariat was mandated, let's say, by the membership to do more on the implementation, on finding out what is being implemented, what is being used, what use does it actually have. So here we're very happy that we came in 2021, we came to an agreement with the Republic of Korea on a project, on an innovative project that started right after the adoption of the standards. So it was a $10 million project to assist countries in implementing. And it is really our Deputy Director General from FAO, Beth Bertha, said this is the first time Codex has received an extra budgetary contribution of this size. And I said at the signing, as I said, well, this is the way it should always be. But obviously, it is also not easy to always find the contributions. Now, there's no time to wait. Obviously, we need to act now to stop foodborne AMR. And there's a lot of support. I think maybe, Jeff, you are going to speak more about what FAO and WHO are doing on this. There's a lot of tools available online and on paper and also on assistance. Now, the ACT project will first start with 4 countries in Asia and 2 countries in South America. And in the future, we hope that we can have more countries and more continents and sustainable support and more donor funding in order to expand this and also to put this on other topics. So sorry for being a little bit longer. There are contacts if you want to get in touch with us and find out more about us. We are on Twitter, we are on the website, and all information, as I said, is readily available. So thank you very much for your patience with me, and see you later for the next session.